Well, there are a few things that I've learned over now more than 28 years in HIV, right from the very beginning, is that when you put resources into research, both basic and clinical research, dividends get paid. We've come a long way. We still have serious problems with HIV globally, but the amount and the depth and breadth of discoveries that have occurred that have led to life-saving drugs for a disease that at one time was considered a death sentence, those kinds of scientific advances are really breathtaking. And they would not have occurred had there not been a large infusion of resources. With the resources came the attraction of young, bright scientists to come into the field and to give it their very best, and the results have really been extraordinary. The other thing I learned from the very beginning, because HIV/AIDS early on was a disease that had a lot of stigma associated with it. To some extent, there is some stigma even now. But people were not particularly interested in getting involved, and either it was avoided, it was looking the other way, or people did not want to get involved in realizing that this was an impending problem that was going to explode. And I think the activist community, particularly the young gay activists in the mid-'80s, late '80s and early '90s, played an enormous role in getting attention paid to a disease which now, unfortunately, has proven to be one of the most devastating pandemics our civilization has ever been confronted with. But early on, to get those people to bring attention to the government officials, the people who appropriate money, the people who regulate drugs, all of those people were really put on the spot by the activists, like, tell us why you're doing this. We want to be transparent. We don't want things dictated to us. And at the end of the day, it worked out very well for everyone.
Let's stay with that for a moment, because the timelines of science are always much longer than the angst of advocates.
Right.
They want a cure now. They
Right.
want some treatment now. Tell us that dynamic, because the science caught up to the advocacy, which to me is a dramatic model. What can you say about that?
Well, I think what we've learned is, and the activists have learned that too, is that in an activist mode, you bring attention to a problem, but just because you bring attention to it doesn't mean it's going to be fixed tomorrow. So you have to be in it for the long run. You have to keep putting pressure on whatever segment of society, be it the scientific segment of society, the regulatory segment, the people who give the resources, that this is a long-range issue. This is not something that's going to be fixed in a day. So on the one hand, you have to keep putting the pressure on, but on the other hand, you can't say, well, I tried and it didn't work. It's not going to work in a month or a year or in a few years. It's going to work over a period of time that's likely measured in decades.
Describe the conversation you would have with a young man who was HIV positive 10, 15 years ago, and what the conversation is today.
Well, the conversation that we had with people before we had the existence of life-saving drugs is that you have a very serious disease, an infection that will likely progress. We don't have adequate treatment. It has complications associated with it. We can do a lot for the complications, the opportunistic infections and the other complications that people get from HIV. But I can promise you that as the months and years go by, we're getting better and better with better drugs. We first started off with the first drug, which was approved in 1986, 87. And alone, that was AZT. That drug gave a little blip of improvement, but it wasn't very, very much. And after a while, people reverted to a progression of disease. Following that, we had another couple of drugs that were added to the armamentarium. And then when we had the right combination of 3 or more drugs that were very potent in suppressing the virus, then instead of saying, hang on, we're getting there, soon we'll have drugs that will work, now when someone comes in, we say, well, it's unfortunate that you've been infected, but we have a drug regimen for you that if you take it, take care of yourself, get good medical follow-up, you're going to do quite well. In fact, there's a reasonable chance you might have a normal lifespan.